My name is Kathy. I'm 62 years old. We live in Coeur d'Alene, Idaho, beautiful little resort town. Gosh, life was really full with golf, tennis, ministry, raising grandchildren, not raising, babysitting, which is my joy. Well, I was having a pain in my leg, which was misdiagnosed as a sciatic nerve for about 4 or 5 months. The pain got worse, and I started taking Advil and more Advil, till finally I insisted on my own to have an MRI, and they found a tumor on my spine. From there, of course, I had the scans, the PET scan, the CAT scan, and it was found out that I had lung cancer that had gone to my spine, my brain, my bones in my spine, and my hip, and it was pretty bad. So looking at my options and finding out, Oasis of Hope was a place of faith, a base faith clinic, which really was the clincher for me, but that they also offered the therapies that I thought would work best for me. I think initially, of course, you're dealing from a fear factor, the unknown, taking a chance to come to a different country is always frightening. You just don't know what you're in for. But when you're in the fight of your life, I don't care, I'm looking at all over the world where I feel the best treatment would be for me. And all over the world, this is, where I would have chosen. I just knew I was in the fight of my life and had to come someplace that would offer me some alternative. When you get here, of course, it's still a little scary. You don't know anybody, but that doesn't take long because the patients that are coming here, we're all in the same boat. We all feel the same way, and we make friends really quickly. And I think we make lifelong friends. There's no one that understands you like another patient. Well, the treatments overall, you don't really have too many side effects. You're getting a great detox when you get here, which everybody could use. You're getting high doses of vitamin C, Laetrile, those are all easy. It's just some of them are lengthy, just being in the treatment room, which is lovely, by the way. Having a companion means everything. It is your rock, and my husband has been my rock through this whole thing, without a doubt. We took communion together every night while we were here. It was a really neat spiritual time for us because we had nothing but our time together and what we were doing. We were on a mission, and just having, again, Ernesto in the morning coming in. We have praise and worship in the morning. We have Sunday services. Experiencing that with my husband, all of it has been a wonderful thing. You have to fight. You just, you have to do your own research. You have to pray and ask for God's guidance, which He will gladly give you if you're open to it. Be open-minded. I mean, there's a lot of different therapies out in the world besides just what we're given in the States. Be open and be adventurous, Go places, and you find out it's a wonderful thing to meet people here from all over the world that you would have never met. For me, I guess the pray, and pray some more, because God is the ultimate healer. I was asked to speak at our women's church luncheon, and I was telling a little bit of my story, and I just said, I'm not terminal, I'm eternal. And everyone stood up on their feet and gave me, this is one of those moments that just kind of came out of my mouth. I wasn't prepared to say, but it's really true. The doctors give you some label, and it's like, no, I don't care what you say. I'm not terminal, I'm eternal. So that was always my hope.